Hello, my name is Diego Castañeda, and I will be talking about futile treatments as an ethical dilemma. Futile treatments pose a dangerous ethical dilemma issue in that we may subject patients to further treatment that may be rather painful and unnecessary. This video will be looking at an article called "Should Doctors Provide Futile Medical Treatment if Patients or Their Proxies Are Prepared to Pay for it?" And basically, this says that it is justified as long as the treatment is harmless and has a placebo effect. In deciding about a request for futile treatment, doctors should be guided by the ethical principles of patient autonomy, beneficence, non-maleficence, and justice. We will also be talking about Immanuel Kant's perspective on palliative care and futile treatment. Of course, these are all hypothetical. So to summarize the article in 3 points, they first define what futile treatment is, and to define it, they said that futile treatment is usually a means of treatment that is ineffective and inadequate to cure the patient or alleviate their suffering. It is a clinical action serving no useful purpose in attaining a specified goal for a given patient. So they first define what a futile medical treatment is. And then they go after this idea of principlism above all ethical principles, as it refers to the commonly accepted principles of patient autonomy, non-maleficence, beneficence, and justice. This is an easier way of looking at ethical cases in a clinical setting. And it goes on by explaining that there's a balance between benefits and burdens, including immediate detriment, inconvenience, risk of harm, and other costs. So these are all associated with futile care. In the event that patients are deemed futile, they will fall under 3 categories mentioned in this article. The first one is the imminent demise futility, where the patient would soon die despite the purpose of medical treatment. The second would be the lethal condition, where the patient has terminal illness that treatment will not affect and the patient will die soon. And lastly, there is quality futility, where the treatment fails to allow the patient to lead an acceptable quality of life. So, in other words, being a vegetable. Where such treatments are deemed to be withdrawn, patients should be given respective palliative care, unless that has become ineffectual and futile in end-of-life circumstances. So we've all talked about this principlism, so now let's talk about Kant's view. So categorical duty, according to Chamberlain University, is deontological in that it applies universally, that is, at all times and places and circumstances. It is a single criterion for moral action that always applies apart from all considerations, most especially one's own desires. So the issue here is that if death is a centennial event, and that prolonging life is paramount to the purpose of a healthcare worker, then should it be a priority at all times? Wouldn't allowing death through palliative care be the same as killing the patient? If letting someone die is a bad situation, then shouldn't it be a bad situation for all times, according to this universally law of Kant's duty? Under the categorical imperative of duty, formulation 1, it says that one should act only according to the maxim whereby you can at the same time will that it should become a universal law. So if you are a surgeon trying to prolong the life of a patient, shouldn't you give the same amount of effort for all patients? This would be the same argument if you were under the law of the universal law. The second formula states that one should act in such a way that you treat humanity, wherein in your own person or in the person of another, always at the same time as an end and never simply as a means. So if death is universally known to be a bad thing, all actions done by the clinician must be done as an ends and never as a means. Having to decide on palliative care under Kant's views would go against this, because if we allow death, then Kant will view all types of death as acceptable, because he believes everything should be acted universally. From my perspective, I personally see this whole um, futile treatment, it would definitely tie well with the care-based theory from the three schools of ethics, in which they say that um, you they ask you to emphasize with others by making decisions based on what you would wish done for yourself in the same circumstances as the people who will be impacted by your decision. Care-based ethics calls you to ask how you would make a decision if you were to be acted upon by it. Then to make the decision as it impacts another person. Naturally, this frame of ethics lines well with this clinician's principalism, in that it respects the client's wishes as a means of emulating what is best for the patient. If the healthcare provider deems the treatment as futile under this school of ethics, that decision is made because the clinician would not want to undergo this procedure if he or she were the patient's shoes. They would not be subjected themselves to such pain for a chance of living, so why should they do the same for their patient? And I thank you.